Many people in the recovery and other 12-step programs are successful, but these opinions seem to contradict research. According to one of the more reliable studies, common 12-step programs such as AA show a success rate of 3%, while 95% of treatment centers in the United States use these programs. A problem with AA and the basic 12-step programs is that they are often short-term. They do not address the underlying issue of addiction. Addiction causes biochemical changes in the brain and body and must be corrected. While having a support group is great, and surrounding yourself with people that are supportive is very helpful, but the problem with AA and the basic 12-step programs is that they are often short-term, and they do not address the underlying issue in addiction. Addiction causes biochemical changes in the brain and body, and it must be corrected. You may search the internet for drug and alcohol treatment centers, and you will find they are luxurious facilities and high-end rehab centers. This problem is recognized on a national level. The data is clear. Some of these treatment facilities produce poor outcomes. Some people go in and out of treatment centers nearly 10 times. According to Enoch Gordis, director of the National Institute on Alcohol Abuse and Alcoholism, he stated, quote, "Our whole treatment system with its innumerable large and expensive programs are founded on hunch, not evidence, and not science." End quote. The common method of care contradicts research and evidence. You may even notice that some therapists are still struggling with addiction themselves. They haven't figured it out yet. So what works? The answer is lesser-known methods that address the underlying issue, and that is backed by science and data. There are methods that change the brain, body, and behavior. Certain cognitive therapy techniques are supported by lots of research and has shown to boost long-term sobriety and change the brain in a remarkable way. Also, integrating certain nutrients into an addict's diet is very important. One doctor, who was a president of a recovery center, reported that nutritionally based programs produced a 92% success rate. Nutrition is extremely important when recovering. This is because addicts have depleted and malfunctioning neurotransmitters in the brain, which contributes to intense cravings. Once those neurotransmitters are restored through proper nutrition, not only do cravings decrease, but withdrawal symptoms dramatically decrease as well. And there are plenty of studies confirming this.
Alright, so when you drink alcohol, what happens? Well, okay, what happens to the alcohol? Well, that's mainly your liver's job, right? Basically, once the alcohol gets to your stomach, most of it's sent to your liver for processing. In very small amounts, alcohol is more or less harmless, but in excess, it can lead to serious liver complications, and is the leading cause of liver disease in Western nations. Once in the liver cells, or hepatocytes, it can take one of three pathways, one of which involves an enzyme called alcohol dehydrogenase, or simply ADH, and this happens in the cytosol of the cell. Another involves a catalase inside organelles called peroxisomes, and a third involves being converted by the enzyme cytochrome P450-2E1, sometimes just shortened to CYP2E1. All three of these pathways lead to the conversion of alcohol to acetaldehyde. Once the ADH enzyme is used to convert the alcohol, it needs another compound called NAD+, which is then converted into NADH. As NADH levels increase and NAD+ levels decrease, this has two effects. Higher NADH levels tell the cell to start producing more fatty acids, and lower NAD+ levels result in less fatty acid oxidation, both of which lead to more fat production in the liver. Now, excessive fat in the liver is also known as fatty change, or fatty liver, where it gets large, heavy, greasy, and tender. But typically at this point, patients don't have symptoms like fever or high levels of neutrophils in the blood. The liver also often takes on a more yellowish color, which is due to all these fat deposits. And we can see that on histology. All these circles are deposits of fat that contribute to fatty liver disease, and sometimes this buildup of fat in the liver is referred to as steatosis. Treating fatty liver disease usually involves simply stopping alcohol consumption. Okay, so that's fatty liver, but that's not the only thing that excessive alcohol consumption can cause, right? Looking back at our pathways, when you make acetaldehyde from ethanol, you also start to generate these ominous-sounding compounds called reactive oxygen species. You can probably guess that these guys are super reactive and contain oxygen. Some examples are like hydrogen peroxide, the hydroxyl radical, or the superoxide anion. These reactive oxygen species react with different components of the hepatocyte, like proteins and even DNA, and this process can cause serious damage to the cells. Besides producing reactive oxygen species, now we've also got acetaldehyde to worry about. And this compound can bind to macromolecules, enzymes, the cell membrane, and all sorts of other compounds inside the cell. When they bind to some of these, they effectively inhibit that molecule. And when that happens, they form what are called acetaldehyde adducts. And when those are formed, your immune system recognizes these new compounds as foreign and starts sending neutrophils to sort of clean up the damage. So not only do you get these adducts binding to and potentially messing with the function of certain molecules in the cell, you also get destruction of the hepatocytes by neutrophilic infiltration. As the cells become inflamed and damaged, patients have now developed alcoholic hepatitis. And we start to note a change on histology and notice these bundles of proteins called Mallory bodies. Specifically, these are damaged intermediate filaments and are located in the cytoplasm of hepatocytes. The mechanism that produces these bodies is still unclear, but they're most commonly seen in alcoholic hepatitis. At this point, the patient might have hepatomegaly that's probably become painful, since the liver is seeing more and more immune cells. They also may have neutrophilic leukocytosis, or an increased amount of neutrophils in the blood. Also, as cells become damaged and die off, scar tissue starts to form around the central veins of the liver, known as paravenular fibrosis. The damage done to hepatocytes also results in leakage of liver enzymes like alanine aminotransferase, or ALT, or aspartate aminotransferase, or AST, both types of transaminase. Usually, even though both are elevated, AST will be found to be greater than ALT in alcoholic hepatitis. In addition to these two, serum alkaline phosphatase, or ALP, and gamma-glutamyl-transferase, or GGT, will also be elevated. In some cases, thrombocytopenia, a deficiency of platelets in the blood, as well as possible hypoglycemia, or low blood sugar, can also be found in the blood of someone with alcoholic liver disease. Treatment again involves completely stopping alcohol consumption, and in some cases corticosteroids can help suppress the immune system. Finally, if it's allowed to progress far enough, chronic alcohol-induced liver damage may lead to cirrhosis and liver failure.
Hi, Debbie Williams here. You binge drink and you want to stop. I see many clients for this particular issue, and it's quite easy to sort it out because basically if you binge drink you haven't got a strategy of somebody who's able to go out and have a few drinks and then stop but still enjoy their evening. Now, many clients that come to me, if it's a lady, it's the case of they've maybe blacked out a few times and have worried that, crikey, if I do that, what on earth could happen to me in that state? And so that's motivated them to want to stop. Or if it's a gentleman, it's a case of, well, I'm getting fed up of being this way in the world. I want to have some control. So with my recording, Stop Binge Drinking, I put everything that I use on a one-to-one session onto this recording, so it has exercises for you to go through that will literally interrupt the old pattern, and the trance track will install new software, that of a normal social drinker that can have a few drinks, feel merry, but then know their limits. And this is an area that I have had phenomenal success in because it is a simple strategy. Usually you perhaps plan to go out and you say in your mind, oh, I'm going to go out and I hope I don't get hammered, or maybe I know I'm going to get hammered. Either way, your mind is focusing on the movie of being hammered, so that's what happens. It follows through on that at an unconscious level, and it feels totally out of control. So we will replace that with a better strategy of being able to have enough alcohol to feel merry, to enjoy your evening, but to see yourself coming home safe after a great night out and enjoying the evening. And that's how it should be. Great talking to you today, and know that you can purchase my product and have the confidence that it's got a full 60-day money-back guarantee. So if for any reason it doesn't work for you, you can get your money back. Anyway, it's great talking to you today. Bye now.
Blackbird singing in a dead of night. Take these broken wings and learn to fly all your life. You were only waiting for this moment to arise. Blackbird singing in a dead of night. Take these sunken eyes and learn to see all your life. You were only waiting for this moment to be free. Blackbird flying, blackbird flying into the light of the dark black night. Blackbird flying, blackbird flying into the light of the dark black night. Blackbird singing in a dead of night. Take these broken wings and learn to fly all your life. You were only waiting for this moment to arise. You were only waiting for this moment to arise. You were only waiting for this moment to arise.